Good morning, everyone. It's Wednesday, May the 27th. The first thing I've got to report is, again, we've lost another West Virginian. We lost a 75-year-old male from Preston County. That's our, like I said, our 74th death. Again, if you just look at the numbers and you just say, well, we've lost 74 people compared to other states that are around us, or compared to what's going on in the nation. We're teetering on 100,000 people that we've lost in the nation, and surely if you don't divide it by population, but if you just divide it by states, that's 2,000 people per state. And I surely understand the math in doing it by population, but when you look at our 74 compared to any of those numbers, it's really good. But from the standpoint of this wonderful West Virginian from Preston County and all his loved ones and everything, there isn't anything good about it. And so we should all look at this just this way. We've lost 74, and we've lost 74 too many. And so please, like I said over and over and over, please keep them and all their loved ones in your thoughts and prayers, and try to think about them, really and truly, because these people are great people, and this terrible disease and killer just swept in from no man's land, and we've tried to protect in every way. The first state in the nation to test all of our nursing homes and assisted living and on and on and on, and so we've sure tried, but at the same time, we should always try to achieve and not just try real hard, but and that's surely what everybody's trying to do. If I could just read through a few things. This is week 5 of our West Virginia Strong, the Comeback Reopening Plan. Another round of reopenings begins on May the 30th. Week 6 of our reopening plan begins on Monday, June the 1st. And all these businesses that are on, surely must follow the guidelines that'll be on my website. I want to talk to you just a second about Hutton'sville. We now have 83 confirmed positives at Hutton'sville. We have tested all the staff and all the inmates, and we have no additional positives that have been tested on our staff. And Betsy Jividen will give you more of an update on that in just a few minutes. But the long and the short of that is just one thing and one thing only, and that's exactly what we've done. And we did it with our nursing homes. It was a really bold approach, to say we're going to test all the nursing homes, period. Because they're surely the most vulnerable, and being the most elderly and everything, we needed to test them all, and we did it, and we pulled it off. And I'm sure it's saving lives, but we still have got to work, to watch and look out for the old. We didn't have a single test in all of our correctional facilities that tested positive up until just all of a sudden just a few days ago. Well, and when it and again, I don't need the credit. I don't need credit for anything. All I want to do is make the right decisions. And when it came to me that we were testing a block of prisoners and testing all the staff that worked with those prisoners that were exposed to one another in the block, I said, no. It's not enough. We're going to test everybody in the whole facility. And so we jumped on it and we took off testing everybody in the whole facility. The net of the whole thing is just this. We're going to, if we were to test everybody that'd be walking down the street, there's people that we're going to catch that are asymptomatic, and they're going to read positives. And if they read positives, the great part about that is then we can tell them and isolate them and contact trace them and all this different stuff that goes on. And we can do the same kind of stuff with these prisoners. So most all the other states have had a really bad go of it with their prisons and everything. All these people are in an area, that's confined and you know, naturally they interact in a closer area, so therefore they're more exposed. But I hope and pray in what we're doing is the right thing, and it was the expedient thing, and at the end of the day, it will protect these people because, as I've said over and over, they deserve to be protected just as much as I deserve or all the rest of us deserves. And so we want to do the right thing, and I hope and pray that we're on it. We were on it very quickly, and we're going to stay on top of it. Now, I've got to read some more stuff here to you. You know, as far as West Virginia innovation, this is really neat, and this is the stuff that we're doing and has been going on and everything. But since early March, when this COVID-19 began to spread across the United States, West Virginia has been at the forefront of innovative response efforts. Utilizing a whole of government approach, we have built response capabilities throughout the Mountain State. Together, we have found innovative ways to produce, and get this, ventilators, 3D printed swabs, reusable medical gowns, hydrogen peroxide disinfecting systems, and the West Virginia mask. Today, General Hoyer is going to tell you more about all these products and everything, but the dedication, creativity, resourcefulness, and the working together of all the levels across our state have brought together a tremendous example of just how great West Virginians are. For crying out loud, I've told you it over and over and over. I could never be more proud of West Virginia and West Virginians because they are the heart and soul of this country. They've been the heart and soul from the standpoint of, you know, their participation in the military. They have done so much, but at the end of the day, the very things that they are the greatest at is they're smart, they're innovative people, they're creative people, they're craftsmen. And you see it right here, and you see it that's just happened. So congratulations again, West Virginia, and I'm sure General Hoyer will be talking a whole lot more about that. You know, I want to talk about our cities and our counties and the applications that they've made. We have now, we have 5 applications that have been, you know, I'm sorry, as of this morning, we have received 7 completed applications. 5 of those 7 applications have now been paid in full, and although the dollars are not significant, these were the dollars that were requested, and these 5 have been paid in full, and the others we are processing immediately, and we have paid 100% of what they applied for. The only thing that you've got to understand is the restrictions were really, really tight right now. But they are beginning to loosen up and everything. And all of these counties and cities, you know, that have applied will have more and more bites at the apple where they can reapply and reapply. And so we're really happy that these dollars are out. And so, you know, we would just encourage more and more and more for our counties and our cities to continue to apply, and we'll just keep pumping the money out to everybody. I don't have a lot of stuff today. The only other thing I'd like to remind you again about the census. You know, I love that lady's idea, you know, from the standpoint of maybe like a team captain in a neighborhood or a team captain on a street, that they'll take the responsibility and, you know, and take maybe my wishes and everything to just call everybody on the street and just ask them, because we got to get everybody counted, and we really, really need to get on that hot and heavy right now. Now, if I could go just a second to our graphs, and you'll see in our recovered and active cases, if I could put that up first. Hold on. Okay, if I could brag while we're just sitting here on Jordan Dameron, over the past weeks, we had a little trouble from time to time, and then he's really responded, and I thought he wasn't going to be able to get that up, you know, so I could give him a hard time, but anyway, he did get it up. But I appreciate him, and he does great work, and all his team as well. But if you'll see On the recovered cases, we're at 1,191 recovered and 602 that were still active. You know, I really want you to pay close attention to this right here. You know, this is the daily percent of positive cases, the second graph. And you'll look at that, how you know, from, and let me get the date here. Well, I don't have the date, but I would guess by looking at this is probably about the 1st of May, those two spikes you see right there in the middle. And from there, we started declining and working our way towards 3, and then I said, if we get to 2, we'll start reopening. We got into 2s, and you'll see it across through there. And then you see at the end, you see this big giant spike. Well, that's Huttonville. That's what that is. That's the prison there. And that is exactly what we want the numbers to do and to show us. You see, as that happens, it's got to have happened somewhere. Now, if it were community spread and it were all over the place, we'd have a big time problem with that area, and we would absolutely move to try to do something to change everything that was going on in that area and change very quickly. But that spike right there leads us to run to the fire. And that is exactly what we're doing at Huttonville right now. We're running to the fire. Thank goodness it's not community spread, but we still got to watch. But that is exactly why we said over and over and over, we want something that's scientific and mathematical that we can follow and run to the fire when we see just that happen. Now, you can see that our positives versus the total number on the third graph on the bottom, it is slightly moving upward, but that's impacted again by Huttonville. We've gone from a low, I think, of 1.91 to where now we're back to 2.11, and we're moving the wrong way, and we've got to make sure that we get places like Huttonville, you know, we get that under control, we get it under control quickly, and our medical team is doing just that. They're doing a really good job at it, and I'm proud of them for doing it. So anyway, that's all I've got. Thank you.
All right, thank you, Governor. Let's first go to Betsy Jividen, the Commissioner of the West Virginia Division of Corrections and Rehabilitation.
There. Good morning, everyone. As the governor has told you, we updated our website last night. We were up to 76 positives. This morning's numbers reflect 83 positive inmates. All positives have been moved and separated, and we continue to move inmates and separate inmates as the additional results come in. We're going to continue responding to this based upon the results of this enhanced testing, and in coordination with the medical team and the experts, we will continue to look at contact tracing and case investigations and take this process where it needs. I do want to point out that we have been on this and we have been proactively responding since the first part of March, since March 3rd. We immediately put staff and inmate screening into place in our facilities. Inmates who come into the regional jails are quarantined for 14 days before they're allowed to go into general population. We've been following the CDC guidelines, which have been the testing of symptomatic inmates. We have medical providers at all of our facilities. They have been the ones that have been determining who gets tested and who doesn't, up until the incident at Huttonville, which, as I think I said yesterday, was caught through our procedures that have been in place since early March. The positive inmate was caught through our medical screening, our medical testing by our medical providers, by the lab. And at that point, we tested the block, and then with the governor's directive and assistance and quick action, we were able to test the whole facility. We have had enhanced cleaning procedures in. We have curtailed movement. We curtailed visitation. Volunteers came out of the facilities. Masks were issued to all inmate and staff early in April. We have internal audit teams that have visited our facilities. We had CDC teams that came and visited some of our facilities. So we have been working, and we have put into place a number of preventative and precautionary measures. And I think the dedication and experience of the leadership that we have at our facilities and throughout the DCR this is a testament to them, because we have had good results. We have had no problems up until the Hutton'sville, and as everyone knows, we are dealing with that. As the research has come back, and we're learning about the spread by asymptomatic individuals, the enhanced testing is giving us the ability to protect our population, to separate people out who are positive from people who are negative. It is going to instruct us on further operational ways to protect the population and in turn the community. So we are looking at the results. We are looking at the contact tracing. It's being done by the COVID response team, by the experts. I want to thank everybody who has come to our aid and assistance, especially over these past few days and weeks. We also recognize that with the courts opening back up and law enforcement is taking a more active role, our numbers are ticking up in the jail, so that looking at jail populations and the ability and protocols that we can put into place for surveillance testing, targeted testing, is something that we are reviewing carefully with the expert medical providers, with Dr. Marsh, with DHHR, with the Bureau of Public Health, and with local county health departments. So we are on it and working hard. We had agreements with the court before where when the courts were closed, there were no appearances. We have been trying to do things by video. But again, as the courts open and there are more inmate transports, more appearances, and more arrests, we are going to see our numbers tick up, and we want to make sure that we can take precautions to offset the difficulties that we may have in continuing to quarantine. We curtailed movement between facilities, and that has given us the space in the prisons where the population does not revolve. We have extra bed space in all of our prisons, so we are able to accommodate changing conditions. And we also are recognizing that with the opening back up and the courts and the way that the jails, we have people coming in and out the front and back doors continually every day, that we need to protect the community, and we want to do what we can about our staff testing, and also make sure that any inmates that are being released are not coming out with a positive test result. So we are on it. We are working together with the COVID response team under the guidance, the expert guidance of Dr. Marsh and Dr. Slem, and with ground support from the National Guard. I want to thank everybody and thank the governor for the quick response that he directed at Hutton'sville, and we'll continue to report the results. Every morning and evening, the numbers are posted on the DHHR website under the corrections.
All right, thank you, Commissioner. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good morning. We felt it was important this morning to highlight some of the things the governor had talked about related to innovation. And just to put it in context, before I start to hit a couple of key items, early on in March, as we experienced our first threats from this pandemic, the governor tasked us as a group to do a couple of important things. One was to begin to set up our own task force to be able to source our own supply of PPE, as well as testing equipment because we knew there would be challenges, not just nationally, but internationally throughout this pandemic. The second was to look and see how we as West Virginians could use our common sense and ingenuity to address the challenges, not just for the pandemic, but look to see how we could make ourselves more self-sufficient going forward. So we focused on some key items, and we're going to show you a couple of those today. Jordan, if you could put up the automated bag ventilator respirator. So this is a device that takes a bag ventilator and automates it. It was part of the work of Azimuth Corporation out of Morgantown and some folks from West Virginia University, Josh Day and Dr. Allison Wilson, took this, and when we thought we might have a shortage of ventilators going forward, this is an expedient way to provide support in that environment. What's unique about this is this particular device is now being looked at by the military and particularly special operations and the emergency response community in the military to be used for field expedient ventilator capabilities going forward. It'll be tested by some other folks within the federal government going forward. So again, an example of what the governor tasked us to do was, how do you address our own problems, but how do we create that into an opportunity going forward for West Virginia to be an innovative leader? The next would be 3D swabs. Jordan, if you could put that up. So working with West Virginia University Hospital, their innovation hub at the university, and a company called Form Labs. Some folks, Dr. Laura Gibson, Gene Cilentro, Pete Parada, and Mr. Max Lavotsky, who is the CEO of Form Labs, got the system set up for us now in West Virginia to make our own swabs. We'll have the capability going forward to make up to 10,000 swabs a week that will again enhance our ability as a state to be able to test because of continued challenges nationally of getting testing equipment. Another piece that we will be working related to this is to be able to make our own transport tubes going forward as well using an injection mold system. The next are the reusable gowns. So a couple of different variations. This particular version is a product that was presented to us by some folks, and these are being made by our prison industries folks. And so Dow Chemical provided us the material for this, and our prison industry folks made the gowns based on a pattern. Jordan, if you could roll through I believe there's a couple other examples of gowns that we have.
I don't have those, sir, but we'll put them on the website.
Okay, and there will be a video posted on the website, but a couple other things related to the gowns. There's a version that's made out of a product similar to Gore-Tex that's a reusable and can be sanitized after use and then reused multiple times. There's also one developed by a company called Mustang Survival, which has a facility in Spencer, West Virginia, that's also reusable. But the one of the other things related to the Gore-Tex in this particular gown is we challenged the folks at prison industries and the inmates to take this on as a personal thing and make a better product. And they've already made a third and fourth version of these. And this is an example of the Gore-Tex material, and there's also a nylon one. So we will build these into our reserve that the governor's tasked us to build up a 6-month reserve of PPE so that we as the state, if we experience a further wave of this going forward later in the winter or early spring, we will have the appropriate 6-month supply of PPE. The next is a couple of different versions of masks. And Jordan, I believe you have one mask version there. So this we're going to call the West Virginia mask. This particular mask, we have the prototype that will be in the end of this week. We'll go to WVU and NIOSH for testing, for final testing. It's already been tested once in a 3D printed version. And this will be the equivalent of an N95 mask or higher. And we will be able to make those in the state of West Virginia and control our own supply of masks. Again, we will put enough masks in the reserve. And because they are reusable, we have to keep a much smaller supply to meet our reserve numbers going forward. The next is a hydrogen peroxide vapor machine. So we have purchased 22 of these for the state of West Virginia. And as Commissioner Jividen talked about, the Guard will be supporting the facility there at Hutton'sville with cleaning. We've done other facilities at state government. We've done long-term care facilities. This machine can also be used to clean an HVAC system. We've already done the testing and received back the results on that. And to date, we have helped to sanitize over 500 first responder vehicles. So protecting our first responders on the front lines is important. Those first responders who transport COVID positive patients, this is another way to help us reduce the spread. And as the governor pushed us to come up with innovative ways to mitigate the spread of the virus. And the two last items I'll talk about. One is a sewn mask that we have, and we don't have a picture of that, but it'll be on the video and the website we'll have available. And just as an example, yesterday, Prison Industries produced 3,000 of the sewn masks for the state of West Virginia. So we'll have those going forward, not just to keep our reserve. They are rated higher than a surgical mask, and they are reusable, can be decontaminated, sanitized easily. And then the last thing that the governor tasked us to do was put together a best practices team that goes out to, for example, Hutton'sville, that we've got folks out in restaurants and businesses in different sectors throughout the state, working right now, again, to reduce the mitigation and the spread of the virus going forward. So we appreciate all the various folks. CAMC was another partner in helping us test things. We've partnered with Kanawha County and Cabell County on the processes to be able to decontaminate and sanitize vehicles. So a lot of folks, as the governor said, from West Virginia, from different sectors coming together. And this will be important not just for us as this pandemic goes forward, but looking at consortiums we can build going forward for the state of West Virginia to control our own destiny on PPE to be better suited going forward and reduce the cost to all of our businesses and our medical community. Thank you.
Thank you, General. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Good morning, and I'd like to make a few comments based on what Commissioner Jividen talked about and General Hoyer, as well as the governor. So we know that with the reopening, the comeback plan, that we have more person-to-person contact. And as we have learned in the past that the COVID virus, the pandemic, is still with us. We just passed 100,000 deaths in our country, and we have about 1.6 million people infected in the United States of America, and over 5.5 million people infected across the world. So as we go back out, we know that the uptick in COVID cases will go up. And again, what we're really imploring all of you in West Virginia to do is continue to do the things that you know that will reduce the person-to-person spread of the virus. And now we're adding wearing face masks or face covers, particularly in situations where you can't separate for 6 feet or more outside, or when you're inside, when at all possible. But as we're looking at this, we're starting to see that we are getting more cases. And as Commissioner Jividen said, in Hutton'sville, this is our first correctional facility congregate setting number of cases. And we know across the country that if you look at where the number of cases and vulnerable populations that can die from this spread are really located. Generally, the most important ones are around nursing homes, and the governor has pointed out that we have been very aggressive under his direction to test people in nursing homes and to test staff and residents. The second one is correctional facilities. And as Commissioner Jividen has pointed out, when the courts were closed, we were able to really control that spread, really remarkably, in my opinion, by immediately quarantining people that were new to the prison and making sure that these people were separated effectively from the rest of the population. But now that the courts are open and more people are moving back and forth, there's more activity. We need to continue to adapt our strategies to that too. So we will be working with DHHR and Commissioner Slimp and Secretary Crouch, as well as other people on our task force, to really convert some of the quarantining to more testing, so that we're able to keep track of people who might introduce infection into the correctional facility, and also start to watch the staff in these facilities even closer, given the fact that we're seeing some community spread. Although, as the governor said, the spike that we saw recently is from the correctional facility at Hutton'sville. But as we go back out, we know that we will see more cases and we'll see more spread. And these congregate settings are areas that are important, prevention opportunities for us, and identification of anybody who's infected to be quarantined so that we don't infect the rest of the folks. And to that end, our R0 today ended up at 1, which is the first time we've been as high as 1 in a long time. Now, the R0 that's posted doesn't just take into account community-acquired spread, and that for us is by far most important. And it doesn't necessarily look at the recovered versus active only. So I think that while there's no reason to panic, and we understand that as we reopen, we will see more activity, and we are seeing more activity, and the most activity in the correctional facility at Hutton'sville right at this moment. But it really does underscore the need for us to be really thoughtful and cautious, and not see this as, oh, we're all good and this is over, because we're not. And while West Virginia is one of 12 states in the country with less than 5,000 active cases, as we increase our screening and looking for our vulnerable African American population, and in counties where we see more activity, we are finding more positive cases. And although the rate of these positive cases, particularly with our screening in Berkeley and Jefferson, was still below 2%, we know that areas of our state are at risk from spread, not only inside the communities, but from people that visit. We've opened our great tourist attractions. And so we're going to have to continue to evolve our strategies to test in these areas and be really targeted with how we are starting to watch, particularly as we see our R0 value go up, and as we see there are more cases in the state of West Virginia. And even though we're still doing great nationally, and the governor pointed out we're the envy of almost any other state in this country, but we need to be careful because, as we said before, we have the most vulnerable population in the country based on Kaiser Family Foundation's assessment. And we can spread to these vulnerable people just as easily as that we can spread to correctional facilities or other places like we see in Hutton'sville if we're not really careful. So West Virginians, make sure that you're protecting yourself and others. Make sure that you don't let your guard down. Wear your masks and your face coverings when you're out among people where you can't separate. And if you go inside, wear your mask or face coverings. It's really not just protecting you, but it's protecting all the other people around you if you happen to be not symptomatic or pre-symptomatic and you have COVID-19, because you can spread it to a lot of other people unintentionally. So we are, watching closely, and we know that this is a really challenging, issue with us balancing, as the governor said many times, opening the economy with keeping everybody safe and making sure that we are continuing to reduce the rate of spread of COVID-19, because we don't want to overwhelm our health system. And just as we worried about the surge on the first round of our approach to COVID-19, that's still an issue for us. So, but with everybody together, we will do as well. I am a believer in the second phase of this pandemic as we did in the first. So thank you for what you're doing, West Virginians, and keep at it. Don't let down.
Thank you, Dr. Marsh. Next, we'll go to Secretary Bill Crouch with the West Virginia DHHR.
Good morning, everyone. I want to take just a minute to talk about our medical cannabis program. As I've mentioned several times, we have quite a few programs in DHHR that have had high visibility that we're trying to make sure we use the opportunity to keep people informed of. The Office of Medical Cannabis will begin accepting physician registrations tomorrow. The registration application and mandatory 4-hour physician education course can be accessed at www.medcanwv.org. That is medcan, medcan, wv.org. Physician registration and training are essential steps to make medical cannabis available to West Virginians with serious medical conditions. And the Office of Medical Cannabis continues to work during the COVID-19 pandemic with the goal of providing eligible state residents with the ability to procure quality tested medical cannabis as soon as possible. In terms of a quick update, we're going through the reviews that are required for growers, processors, and dispensaries. The growers and processors reviews are completed, and we're about to the end of the 30-day period for those entities to provide additional information and respond to the questions that they've been asked. We're still reviewing dispensaries, which take a little longer. We've sped this up as much as possible. We're looking at actually making the product available in the spring of 2021. So thank you all.
Thank you, Secretary. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Given that one case with symptoms led to then full testing at Hutton'sville, which revealed 80-some previously undetermined cases of coronavirus. One case led to 80. What kind of testing should be going on in other facilities? What don't we know elsewhere at correction facilities in West Virginia? Thank you.
Brad, I can answer it real simple, and that's just this. As we continue to expand our testing capabilities, we should test every single inmate and every single staff person at all of our facilities. And we should move in that direction as quickly as the testing capabilities will allow us to do so. And that's just, from my standpoint, that's my directive. That's what we ought to do. And because now that we do see in one of our correctional facilities just how fast this thing can spread, that's what we ought to do, because there could very well be asymptomatic people in the other facilities, and the likelihood is probably pretty strong.
All right, thank you, Brad. Next, we'll go to Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I hear the commissioner saying that she's proud of the job the corrections has done, and rightfully so. They didn't have any positive tests for a long time, but everybody's great at keeping the house from burning down until there's a fire. So now there's a fire, and I hear that we're consulting with medical experts, and the governor just says that we're going to do this as soon as possible. I'd like to ask Dr. Marsh, from a medical standpoint, as you consult with the governor and with the commissioner, what is the trigger switch for you to actually start testing instead of just talking about it? When do we start testing regional jails? When do we start testing every staff member? When do we start testing every prisoner? Who has a likelihood of possibly having the coronavirus without us knowing it. From a medical standpoint, what would you recommend?
Governor, you good for me to go?
Please, yes, sir.
So Kenny, thanks for that question. And I think that that is a truly important one. When we look around the country, the three areas, the three sectors that have a lot of coronavirus positivity and are at risk for great spread are, number one, the nursing homes. And we know that there's a great percent of people around the country and around the world who die from these facilities, these congregate facilities with very vulnerable people, the correctional facilities, and the processing plants for food. And so as we look at the correctional facilities, certainly the governor just gave you, to me, the right answer that we have already planned and need to move rapidly to testing these facilities. Certainly, we need to test people who are coming in and out of these facilities, as Commissioner Jividen said. You know, since many people that are stationed in some of these facilities are not as mobile back and forth, you know, if things have been contained for 14 days and we see a stable population with no activity, then per CDC guidelines, those would be people, even if they had been positive, would have recovered. New people coming in and people coming back and forth from communities are where the risk is of inducing that. So we would initially look to see how stable the population has been, look for people who are coming in and out. If there's been a movement in the population, if there's not been stability, then to me those populations should be tested as soon as we identify the capacity to do so, which should be very soon. And then as we look at communities where we see more activity, then I think that we certainly want to keep an eye testing-wise on people that work in those facilities, since they can introduce from the community back and forth. And also, I think we need to design a surveillance strategy to be able to monitor those folks, as well as folks that work in nursing homes. So I think as we are moving to this next phase, we know that a very strategic and intentional assessment and testing of the congregate populations in the correctional facilities and people that come in and out who work there is really important. In the nursing homes, really important. In communities where we see activity, and make sure that we are looking for spread back and forth, and for people who come into these facilities and go out, as Commissioner Jividen says, they need to be tested. So I would say that we need to do that very, very quickly. And we are reconnoitering even today to look at capacity and follow the governor's directive, which I think is very smart.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Commissioner Jividen, I was wondering if you could talk a little bit more about what we've learned so far from the contact tracing. I think it was the end of last week that Brian Abraham said we had identified the patient zero and we knew how this got into the facility. What else have we learned since then?
Okay. I think I would prefer to refer that question to the Bureau for Behavioral Health. They are the ones who are actually conducting the contact tracing. It is still going on as every positive result comes back. Interviews and paperwork are being filled out. So that is being looked at and explored. That is being done in conjunction with DHHR and the Bureau for Public Health. So at this point, I don't know if I'm prepared to comment on that. I don't know if Secretary Crouch is. We can certainly circle back on that and find out what, if anything, we know. But I think until all the testing is finished and the results come in, we won't have that contact tracing available to look at. And I could be wrong on that. Like I said, I would defer to the Bureau of Public Health or to Dr. Marsh.
Bill, do you have any more information?
Those investigations are still ongoing. We don't have a summary of those yet, but we should have those within the next couple of days.
All right, thank you, Charles. Next, we'll go to Amanda Barron with WSAZ.
Hi there, Amanda Barron with WSAZ. I wondered what you're hearing from small business owners, like the help that they need financially, and how the CARES Act restrictions could be eased to pay for some non-payroll related expenses related to COVID-19. Of course, reopening is good, but a study says that more than half of small restaurant owners have acquired more than $50,000 in debt related to COVID-19, mainly to accommodate health guidelines and things like that. So I just wonder what you're hearing from them about that, and what kind of things we need to tell our federal lawmakers about those restrictions being eased. What could help?
Okay, Amanda, maybe I can take that, but Amanda, I keep going back to the same thing. You know, the same things are all of our small businesses need to be trying to take advantage of the PPP loans. And if you haven't done that, you got to do that, and it's really important. And if you're running into obstacles about qualification, call us. We'll try to help. If we can't help, absolutely call somebody from the SBA, or call somebody off of their websites, or call a bank. And if you keep running into obstacles, call us. Now, on top of all that, of everything in the world that I should know business. And I get it wholeheartedly. And as fast as we possibly can, we're going to relax the requirements on, say, restaurants, at a 50% capacity. I know all of that and everything, and we're working that. We're working all of our senators and congressmen and congresswomen in DC and everything, and pushing them in every way. We're absolutely working the federal government. You know of my discussions with the president. I mean, it's ongoing and everything, and his team, in regard to every aspect of being able to backfill revenue, be able to relax, restrictions in regard to an 8-week period. Many people that signed up for the PPP program have already burned through the 8 weeks, and now they're sitting and don't know what to do and everything. And maybe they burned through the 8 weeks and weren't able to pay a payroll because they had their people, the place was closed or whatever it may be. They need an extension of that 8-week period, at least to double the time of that period. So all these things we're working, and we're working in every way. And all I would say is, if you have a specific question or a specific concern, call us. And absolutely, our team will try in every way to help you and to help you to be able to get to a good outcome.
All right, thank you, Amanda. Next, we'll go to Paul Mullen with WCBC.
Thank you, and good morning. This is a class of 2020 athletics question, Governor. I ran across a case this week, a baseball player, Ethan Haskell from Preston County, who is a left-handed pitcher, but he was born without a right hand, and he basically got pandemicked out of his senior season. I was wondering, since most of the time graduation from athletics takes the form of playing in your last game, if maybe the SSAC could arrange maybe a series of games for the class of 2020 spring athletes that they could at least get something out of their senior year. Governor?
Well, the young man that you just referred to, God bless him for his courage, and just imagine, what a courageous, great young man that you're talking about there. And, I get it wholeheartedly. There was a girl last night, her name's Haley McClure. She played for me. She's 3-time first team All-State in basketball. She said today, she's going to sign today at 1 o'clock and wanted me to be able to come to her signing. Of course, I can't go because I've surely got to be here, and I hate it and everything. But, she was on a team that had advanced to the state tournament, was getting ready to play Martinsburg in the state tournament and everything when the tournament had to be called because of what was going on. You know, she's a graduate that's not been able to go through a typical graduation, and she's one of many, many, many. I know, you know, Bernie Dolan and his team at the SSAC are doing fabulous work, and it is just plain really complicated. You know, when you have a kid graduate, you know, and then being able to bring them back, and from the safety of athletics and all the liabilities and everything that come with that today, you know, it is just flat complicated. And from the collegiate, you know, rules and everything for a kid to be able to come back and play and everything, there's many, many, many hoops to jump through. But I'm sure they're trying to do anything and everything they can possibly do, because these kids, you know, have devoted so much time to their athletics, to their schoolwork, to their graduations, to on and on and on. And it's a shame. It's just a crying shame. And from the standpoint of a coach, you know, I really get it. And all I can do is rely upon our SSAC and the great work that they do. I've got all the confidence in the world in them, and they're led by a great man in Bernie Dolan. And you know, it's just, you know, I really feel like if there's a way for them to work something out, you know, they'll work it out. But you've got to, again, congratulate that young man, and thank you for him and all those that are out there, you know, that have done great in athletics and academics and good stuff at our school systems. Thank you.
All right, thank you, Paul. Next, we'll go to David Beard with the Dominion Post.
Hi, this is David Beard. I'm wondering about safety and possible community spread at the casinos as they reopen. They sit near the borders. They probably draw a lot of out-of-state residents. A lot of them probably elderly. People are in there for hours smoking and drinking, so I don't think there's going to be a lot of mask wearing. Do you have any? Are you going to be watching those places closely? Are you concerned about safety at those? Thanks.
David, my answer is really simple, and I'm sure our medical team would say the same thing. Sure, we're concerned. You know, we're going to stay concerned. You know, at the same time, West Virginia's numbers are phenomenal compared to all of our bordering states and everything. And as we continue to open up and as we continue to move forward, we're going to continue to just watch and do everything we possibly can do. I would highly recommend to anybody that's going in an outside building to wear a mask. I would absolutely highly recommend that we have social distancing and great hygiene, washing your hands and doing all that stuff. I would absolutely stress to the highest possible point to wear a mask and absolutely just practice good casino or good practices. And I would encourage our casinos that they have got to try with all in them to protect the people there, protect the integrity of the casinos, and do the great practicing that I know that they can do too.
All right, thank you, David. Next, we'll go to Mark Curtis with Nexstar Media.
Hello, everyone. I address this to Governor and Commissioner Jividen because I've received some information from a corrections officer at Hutton'sville who wishes to remain anonymous. But the information I was given was that not everyone is wearing PPP. The priority of giving masks went to the COs, but not all the other rank and file staff members, and that wearing of masks by inmates has not been strictly enforced. And this particular CO that contacted us about it was very concerned that the rules were very lax, and thought that, you know, why not, since we're testing all the nursing homes in the state, why not test every single prison and jail as well?
Well, Mark, let me lead off, and then Commissioner Jividen will come in. But let's just go back. And you know, I'm always one that's really hung up on the truth. You know, when everything started with this killer disease, Getting a test with a test kit was a big deal because we didn't have very many of them. In fact, we didn't have many in the nation anywhere. And everybody was caught in a real pickle. And then the biggest thing that everyone was doing on the calls with President Trump and Vice President Pence was over and over and over, we were trying to increase testing capabilities within the United States. And so we have continued and continued and continued to try to just do that. Now just imagine little old West Virginia. Little old West Virginia, today, if the call were yesterday, and people were bragging on governors and states that had accomplished 60% or 70% of the testing of the nursing homes. We were the first one in the whole nation to test them all. We were the first one to go on the aggression to test all of our assisted living. There is no way to test every living human in the state of West Virginia all at one time because the capabilities are just not there. They're just plain not there. So what do? You look as best you possibly can. Every test on corrections just kept coming in and coming in and coming in that we didn't have a problem. We didn't have a problem. And now we got a problem. And now you're hearing from your governor saying, right now, we should now go and test all the facilities. Facilities that we know we don't have a problem yet, but we probably only just have a limited amount of knowledge. So with that, Mark, that's my comment. From the standpoint of those people that should be wearing masks or not wearing masks at the facilities, that's an issue that someone in my system should be taking care of it, and I'll check on it and everything, but Commissioner Jividen can maybe add some stuff to that. But what I am telling you right now that we needed to do, we didn't need to continue to test a block of prisoners. We needed to test all the prisoners, all the staff. We've done that. And we recognize now we even have more positives than what we really thought, and we're on it. And now I'm telling you, without any question, we need to go to the other facilities and do the same thing. But you got to understand, working with just a limited amount of resource, there's only so much you can do all at one time. And so, Commissioner Jividen, if you'd come in, please.
Yes, Mark. Without knowing the specifics of what the correctional officer is telling you, I do know that there was a complaint made this morning by a staff member at Huttonsville regarding not being issued an N95 mask today. That complaint was made, and that officer left the facility before being told by the superintendent that he was in fact moving people around so that people in her particular job category would not be having contact with inmates. So again, without having the specifics, I can't address it any further. I will tell you that we are taking every precaution to protect our staff. And if there are complaints, they should be made to the superintendent. We have full faith in his ability, and he is dedicated and on the job 24/7, trying to protect the health of the staff and the inmates. With respect, the inmates, every inmate in the entire DCR, in all DCR facilities, were issued 2 masks so that one could be washed and they could wear the other one. I do believe that inmates at Huttonsville have been mandated to wear the mask. Sometimes if they are restricted to their units and just among the same people, they are choosing not to wear the masks. Again, we will look into that and see if that is in fact the case. But as far as staff goes, the proper PPE is and should be being issued. To the best of my knowledge, it is, and we will certainly look into that.
All right, thank you, Mark. We have time for one more. We'll go to Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams of Ogden Newspapers, and I do kind of have to piggyback a little bit on Mark's question and go back to the purchase of 100,000 NIOSH approved N95 masks back in March 23rd. Half of those turning out to be an inferior kind of N95 mask, not NIOSH approved. It only had the ear loops. I understand 9,000 of those were distributed to the Division of Corrections and Rehabilitation. I'm curious to know if there are any concerns, especially now with this outbreak in Huttonsville, about the effectiveness of specifically the ear loop type of N95 mask and whether that provides a proper enough seal for corrections officers, or if inmates are getting these. Does that provide enough protection? Is that possibly contributing to some of the issues that we are seeing? Thank you.
Steve, if I could just start off, I know that now this is above my pay grade, but because you're talking about the medical aspects of stuff, but I can tell you that some of the masks that we got have been sent off for additional testing, to be able to attest to their, worthiness and everything. Secretary Sandy would be able to give you a lot more details than I can give you, but somebody maybe on the medical team can address the medical questions, but that's about all that I can give you. General, do you know anything about this that you could add, or?
So, Stephen, the masks that, as the governor referenced, they've sent some of those off for additional testing, the ones with the ear loops to check the seal piece. The other piece related to this is depending upon the interaction that the individual has determines the type of mask that needs to be worn. So the KN95s with the ear loops, while they may not be appropriate for a close patient contact medical setting, can still be used in certain settings going forward. So it would be determined based on the interaction with the correctional officer and the individual inmates, but also for inmates wearing that KN95 equivalent in a normal setting, even though the seal might not be there for the N95 standard, still usable. As Clay's pointed out, and I've pointed out several times, studies show that a mask that is 60% effective, worn 60% of the time, and why the governor keeps pressing us on wearing masks in public relates to the ability of us to reduce the spread. So I think your question is a good question, but it's dependent upon the interaction level and the close proximity of the individuals.
All right. Thank you, Steve. Governor, I'll turn it back to you.
Well, I just touch on just a couple of things. First and foremost, if we look at all the rest of the states and we look at all the correctional facilities across all the rest of the states, and I don't know this number specifically, but I would say that the job that Secretary Sandy, Commissioner Jividen, and others have done with our correctional facilities and our medical team and our guard and everybody running to the fire, and thus far, compared to correctional facilities in other states all over the place, it's been pretty dadgum good. Now, we know that we have issues here, and we want to continue to try to address every one of those. And that's why now we're going to embark on testing everyone. As we do that, I hope and pray we'll be West Virginia strong across that, as well as we've already been in a lot of different areas. This disease is nasty. And we've told you over and over and over that there's still going to be bumps and there's still going to be stormy seas. We're trying to carry the ball and balance between what can open, what can't, what amount of testing can we do with the testing that we have available, who should we be testing? Should it be, our minority or African American communities? Should it be because of the history of, where they could have a higher exposure? Should it be that we should go test all of our jail facilities, where in certain places in the regional jails where people are going in and out and all that kind of issue? There's all kinds of different things to weigh out, But if you step back from it and you say, how did the West Virginia jails do, or how are the West Virginia jails doing compared to the other states' jails? Well, it's pretty dadgum good so far. We're not across the finish line. And we're all going to continue to pull this rope until we get across the finish line. And we're going to protect these people just like we would protect ourselves. Now, I want to commend the National Guard. I want to commend all West Virginians on this innovation stuff that the people are doing. But to be perfectly honest, let's be fair. It's been led by the National Guard. It's been led by General Hoyer. It's been led by all the great people that are in our Guard and all the great stuff that they do. I want to thank everybody, but I want to especially thank them. You see the innovation that they have already come up with. It's amazing. It's truly amazing. And if you were able to go to their warehouse and you were to see the things they're doing as I have done, you'd be really, really, really proud of them. They've done great work, and I surely thank them for that. And the last thing I'd add is just one thing. I've already said this. This game's not over. The seas will still get rough. I said a minute ago, are you concerned? A question was asked, am I still concerned? Of course I am. Of course I'm still concerned. I'm worried to death nonstop because absolutely I know that's how I will stay alert and on my game and absolutely pushing everybody in every way, because I know this killer can kill many, many, many more great West Virginians. So I know the seas are still going to get rough, and I absolutely know we still need to be on our game. And I ask you as West Virginians one more time, and I'll continue to do this no matter how tired you get of listening to me about this, wear your mask. Please wear your mask and everything as you go outside, as you get interacting with people, as you go in a building. It is not that big a deal to do. Just wear your mask and absolutely use your brain. Absolutely protect yourself. If you protect yourself, you're protecting yourself from others, and you're protecting yourself from all your loved ones. You're protecting yourself. Absolutely. Be smart, West Virginians. You already have done it over and over and over. Nobody in the world can deny what you have done. You are absolutely the beacon that Dr. Marsh talks about over and over and over. You can't imagine on the calls with the president and over and over, how they bring up what West Virginia has done. The state that they tabbed the most vulnerable, the state with the most chronic illnesses, the state that is sitting right in the heart of all the population of this country. And yet, you have some way, somehow, transformed a miracle from God, that He has blessed you as West Virginians. So keep it up, keep doing the great work. Nobody can be more proud of you than me. Thank you.